All right, so we're back. So now what we're going to do is we're going to take a look at the foot position of the squat. So there's a lot of things we want to look at, but I really want to address this whole thing with foot position. So like I said before, there's this ongoing debate about where the feet should be placed. So there's foot position where most of the textbooks that you read and descriptions of the squat, I'm backing up again, so I'll get it as far as I can, but they'll talk about having the toes pointed at an angle out, right? So just kind of slightly pointing the toes out. And then there's also other schools of thought that tell you point the feet straight ahead. So let's look at what some of the differences are. Now it's always this kind of this case of black or white, right? And I've been guilty of it as well. We either are on one side of the fence or we're on the other. So rather than just telling you, do it this way or this is right or this is wrong, I've studied this pretty extensively. So what I think is that it's important to kind of present both sides of the case, the pros and cons of both sides, and then let you make a decision on how you want to coach your clients and yourself for how you want to do a squat. So let's take a look first at the toes pointed out position. Okay, so with the toes pointed out, what we get is we get a greater sense of stability. Okay, the thing with getting a greater sense of stability is that with this position, it tends to be more stable in terms of the actual position that you're in. So what I mean is that it's more of a leverage thing, right? You have better leverage in this position to create the stabilization that you need. With the toes pointed in, you don't have as much of that leverage for stabilization, but there's a greater potential for stabilization through muscular contraction. So, and I'll show you what that means in just a bit. So now when we look at toes pointed out, another argument in favor of this is how everything lines up. So if we looked at the model of the human pelvis, what you would see is that when you point the toes out, then it creates a closure mechanism at the sacroiliac joint at the pelvis. So it creates a better form closure. It just kind of fits the innominate and the sacrum. It just fits everything together a lot better. So it creates potentially a more better fitting closure mechanism for the sacroiliac joint. And this is important because there are so many cases of lower back problems and SI joint dysfunction among a lot of the clients you're going to be training. Most people have some kind of SI joint dysfunction. So in this way, it tends to favor that. Also, what you'll see in this, if you look at the gluteus maximus, right, what you would see with the toes pointed out is to some degree, it aligns the fibers of the glutes in a position where they can basically contract more effectively. And the glute maximus and the opposite side, latissimus dorsi, they help to not only provide force closure for the sacroiliac joint, right? There's form closure and there's force closure. Form closure has to do with just the way that the bones are meant to fit together. It's kind of like putting two pieces of a puzzle together, that they fit together. But the force closure is when the muscles contract to stabilize the joint as well. So you have the form closure and then the force closure created, I'm stumbling all over words today, created by the glute maximus and the opposite latissimus dorsi through the thoracolumbar fascia that links between both of them, okay? So those are some arguments in favor of the toes pointed out position. Now, if you have the toes pointed straight ahead, well, there's a little bit of difference that goes on. Now, with the toes pointed out, remember, things kind of fit better at the SI joint. There's potentially the muscle fibers line up better. But what happens here is that part of the function of the glute maximus is extension and external rotation of the femur, okay? So extension and external rotation. Now, when you start with the feet turned out, you're already in external rotation. So you're taking part of that potential for contraction away from the glute maximus. So what you're left with extension, but all in all, what you're left with is a less powerful contraction, right? There's a bit of decreased strength that goes along with that. So what I have found is that when you have the toes pointed straight ahead, what happens is you create more potential for contraction throughout the glute maximus. And there's also a greater demand for stabilization through the abdominal complex as well. So, you know, while there's more, well, I'll show you what this means in a bit, but there's kind of two sides of the fence. One is that there's also, as you'll see, a greater strain or greater stress to the low back and hip musculature, but that could be kind of a bad thing or it could be a good thing depending on what you can get your client to do with it. So in all cases I've seen all the dysfunctions and lower back problems and knee problems and hip problems and yada 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 with the toes pointed out position. And when I have been able to teach people how to squat with toes pointed straight ahead, in all cases, the pain that they had initially experienced, if it was not completely eliminated, then it was greatly reduced. So I've on and on and on for 12 years, I've seen every case of pain and dysfunction either eliminate itself or greatly reduce itself with the toes pointed straight ahead versus the toes pointed out. So when somebody can get, you know, with the toes pointed straight ahead and they can understand how to really recruit all the muscles that we're looking at in a squat, because it's more, let's face it, it's got to be more than just using the thigh muscles or using your hamstrings in a squat. If you're teaching a squat like that, you're completely missing the boat. Your client's going to miss the boat as well, because a squat is, when you do it properly, it integrates so many muscles of your upper body, your lower body, and through the connection link between the upper and lower body, the trunk. But you have to be able to make sure that your client can do it or you can do it. And if they can't, you've got to be able to train it into them. You have to be able to show them how to activate those muscles in that manner. That's the way they're meant to do. So anyways, when you can get somebody to activate those muscles that way, then what I found is that you can teach them, or they can go back to like toes pointed out and have a functional squat pain-free. So again, there's kind of both sides of the coin here. Now, you'll have people who, and maybe this happens to you, when they've been squatting with toes pointed out their whole life, and then you put them with toes pointed straight ahead, you'll see that a lot of times they can't squat right. The knees will cave in, the trunk will fall all over the place, and I go, oh, I can't squat like that, and I'm not meant to squat like that. It's, you know, people will argue it's not functional, this is not how squatting's supposed to be. Well, this is actually, you know, what I found, again, you get the best bang for your buck in this position, and when people can't squat like that, what you're seeing, you're not seeing an inability to squat necessarily. What you're seeing is a reason why they can't squat. They can't squat because they don't have the leverage. They don't have the leveraging and the balance available. So there's more of a demand of the muscles of the, like I talked about, the hips and the trunk. They have to work together, and you're getting an honest look at the function of those muscles. And when you see knees caving in and trunks falling all over the place, it's telling you there's weakness in these muscles, either all of them or some of them or at least one of them. There's a weak link in there. So it's giving you an honest look at what's happening. So now let's also look at, I'm going to use the bar and or the dowel and hopefully give you an idea of what's happening here. Now there's looking at the bar position and what happens here as well. This will give you an idea of where most of the stress goes. Now I'm going to have my toes pointed out here, okay? Now with toes pointed out, you'll also notice that there's less of a forward lean, or less of a need to lean forward with the trunk. So you can maintain a little bit more of an erect squat posture in this position. So if you look at the bar, look how far forward it travels. It doesn't travel that far forward. I'm not excessively leaning forward to do this squat, okay? So ideally, what you're looking at with the bar is if you drop the plumb line from the bar, you would see that ideally what tends to be optimal is the bar should travel, that plumb line should travel somewhere between the toes and the ankle of the feet. So basically, it shouldn't travel forward of your toes, or it shouldn't travel behind the ankle. All right, and what you'll tend to find is that with the toes pointed out, it's easier to maintain that line with the bar in that position of the foot that I talked about. Now, when you go toes pointed straight ahead, what will tend to happen is that the bar will tend to lean a little bit more forward of the toes. So what this is saying is that the bar is the load, okay? And if we look at where the stress is going, well, it creates a little bit longer of a lever. The further away the load goes from the fulcrum, which is the hip, all right, the further forward that, or the further away from the fulcrum the load goes, the more stress to the fulcrum that is created. Now, this might seem like a bad thing if you looked at it, especially if you got somebody with back pain, right? But here's the thing. If there's also, with the toes pointed straight ahead, the bar does travel a little bit more forward, but guess what? That means there's more potential activation for the hips, for the glutes to work. Also, there's more demand on the trunk, the abdominal stabilizers to have to fire so that trunk doesn't collapse forward, right? It keeps enough pressure in that trunk and enough contraction that you have to challenge yourself to stay upright. And again, what I've seen is that most people just don't have enough of the strength within the core musculature and the hips to not allow their trunks to collapse or to go excessively forward. All right, so again, it's kind of this plus and minus with it, right? So there's a decision to be made with how you approach the squat. Now, can you teach somebody to squat effectively with toes pointed out? Well, you probably can. Can you teach someone to squat effectively with toes pointed straight ahead? Well, I've just shared to you with all the cases that I've had, and I have yet to see somebody who cannot squat pain-free, toes pointed straight ahead, and get maximal contraction from all the right muscles involved in doing so. So again, I tend to stick with the toes pointed straight ahead, and it really comes down to what you're comfortable with teaching and what your level of knowledge is in regards to the positions that you're going to train your clients. So I tend to favor with the toes pointed straight ahead. Now, another thing with the toes pointed straight ahead that typically, if you looked at the model of the pelvis, there can potentially be some kind of blockage of the rotation of the pelvis. So you have the femur and you have the pelvis, and if this is the femur, as the femur bends, then the rotation of the pelvis with the ASIS and anterior superior iliac spine and the anterior inferior iliac spine as well, there tends to be a blockage when the rotation can kind of butt up against the femur and block the movement. All right, so if that happens, then what's going to happen is if I can't rotate, my pelvis doesn't rotate now, then what I'm stuck with is kind of leaning forward. Okay, so again, this is a plus and minus situation, right? Further the forward lean, the more stress that goes to the hips and the lower back. But again, this can be a plus or a minus, right? So the thing that I've found most useful is looking out for excessive forward lean. That's that forward lean where somebody's just collapsing their trunk and they just cannot maintain an upright trunk position. Okay, so that's what I look at. Now the last thing I'll talk about with foot position has to do with thinking about function, thinking about how we move, how we perform, regular activities day to day. Sports type activities, because a lot of people are involved either in competitive or even recreational sports. They like to go running, they like to go golfing, they like to play tennis, they like to do things. So if we look at somebody who's, if we're walking or running, if you look at the foot position when you're walking and running, think about if you keep training your feet in a position where the toes are pointed out to the sides, you learn to walk that way, and if you learn to walk that way, you learn to run that way. Now, while this might give you a little bit of leverage with a squat, if you looked at a single leg movement, let's look at a lunge because it's pretty close to the same type of movements we see. If I lunge with my toes pointed straight ahead, that's how we lunge. We don't train clients or ourselves to lunge with our toes pointed out, right? Because if we did, think of what would happen. If we lunge with the toes pointed straight ahead, that's the way our ankle's meant to move, in a sagittal plane. And so is our knee. Now, if we take that position and we turn the toes pointed out, well, guess what? All the force is still going straight ahead. So what this does is it changes the mechanics of the ankle from one of function to dysfunction. The ankle starts to collapse medially, and the knee will follow that. So we've got to really be careful and be thinking about what we're doing, what the outcomes are with the training that we choose. So for this is another reason why I favor the toes pointed straight ahead during squatting, because I like to teach the positions that are going to mimic the functional needs of the everyday environment that me or the people who I've worked with are going to need to exist in. All right, so those are the big things that we're looking at. All right, so again, you know, whatever way you choose, just kind of keep in mind the pros and the cons of each way. All right, so we've talked about that, and then the next thing I'm going to talk about is the rack position. So we do squatting. We're going to be looking at, if you squat with a bar on your back, what the rack position needs to look like.